Well, we hear so much about irregular heart rhythms these days, whether with kids in sports or older adults. Racing hearts and hearts skipping a beat are a huge concern. In today's Health Key, Angela Gannot shows us how quickly they can be diagnosed and treated.
Don Sowers knows all about heart arrhythmias, but it was after he had open heart surgery when his started, and it's actually very common.
When you're in AFib, it'll have like 2 or 3 beats, then there's a space, then it'll go 3 or 4 real rapid, then it'll jump. It's a very squirrely feeling.
The fluttering for Don was his heart racing in the upper chambers, but arrhythmias can occur in different parts of the hearts and they have different consequences.
But there are a lot of people that do feel their arrhythmia as discomfort in their chest, their heart racing, or their heart fluttering and skipping beats. So it can be experienced in a number of different ways.
Dr. Krishna Malineni is an electrophysiologist or an electrician for your heart. He says, think of an arrhythmia as an electrical malfunction. They can happen to anyone, from infants to patients in their 90s.
Very important to diagnose arrhythmia problems sooner than later.
The key is diagnosing the kind you have so he knows how to treat it.
Through veins. So we use what are essentially IVs.
One way to do that is with X-ray equipment. Dr. Malineni places tubes in the veins and wiggles up to where he needs to be and then watches what's going on with your heart. Once he knows what kind of arrhythmia you have, he can start offering some options.
We offer a wide variety of treatment choices, some which are medications and some which might be procedural based, called ablations, and other treatment strategies may include even pacemakers or defibrillators.
It's important to note, while many patients never feel a thing, if certain arrhythmias are left untreated, you may feel dizzy or possibly faint. They can also be very serious, and patients can go into cardiac arrest or even have a stroke. But it doesn't have to be frightening. For Don, he's on the mend, and his advice to anyone who may think they have an irregular heartbeat and is afraid to find out, he says fixing it doesn't hurt a bit.
The procedure, which they go up through the vein, up and through your heart, you have no pain whatsoever. You don't feel a thing. You don't even know it's been done. It's excellent.
Oh, very interesting. Well, track suits, they're easy, but they're not.